the situation in Gaza for children is desperate. As you said, the last couple of weeks, the temperature has dropped dramatically, and with that has also come rain and wind. So the situation for children, as I said, is absolutely desperate. It's bitterly cold, and children are ill-equipped to manage and cope within this terribly cold situation. But of course, they are ill-equipped in terms of their shelter. They do not have shoes. Many children are without shoes, and pretty much all children are without winter clothes, without coats, without jumpers. And you can see the images there. The situation is absolutely awful. And I spent the last couple of weeks visiting the communities where we're providing services, health, nutrition, child protection. And it's really, really desperate. People do not have enough food to eat. There's not enough clean water for people. And children are literally fighting for survival in some of the most desperate conditions.
We also know that many hospitals have been destroyed and that last winter there was a spike in infectious diseases. What medical help is available to those who need it?
You know, with children living in these conditions and with the extreme overcrowding that we see with the forced displacement of children time and time again into much more smaller locations, we will see, and we are seeing, an increase in communicable diseases, diarrhea, respiratory infections, skin infections, and the health services are absolutely decimated. There are very limited health services where children are able to access. There's inadequate healthcare coverage. Doctors, nurses, all of them have been affected, obviously, by the war, have also been displaced and unable to function in facilities that are unable to provide the services because there are not the supplies in place, and there is not fuel for hospitals to keep running. So it's a very, very serious situation where children will be getting sick. We have obviously high rates of malnutrition, and we know if a child is malnourished and also becomes sick with diarrhea or pneumonia, then they can die very, very quickly. It's a very serious situation for children.
In terms of aid getting to where it's needed, how is the flow of that aid, getting the food in, obviously, but also the shelters and the clothing and things that are needed?
Yeah, it's a very complex situation in terms of supplies into Gaza. There are multiple crossings, but yet restrictions on the number of trucks of aid supplies that are able to pass. Save the Children and other partners, you know, we're doing all we can to work through the many different channels to bring in humanitarian aid supplies. But, you know, humanitarian aid supplies are one part of the humanitarian response for children and their families in Gaza. We also need access to populations, and we need to be able to provide some safety and security for our teams to be able to work effectively. So to get the supplies into Gaza, and then obviously the supplies to people, and also being able to provide the services that people are desperately in need of.
Obviously this is impacting so many people, but how does this impact children in particular?
Yeah, I mean, children are obviously the most vulnerable and in this constant war, and they are living in a constant fear, which has now been for over 12 months. So for over 12 months now, children haven't had any access to formal education. So their learning has been massively disrupted. And of course, schools not only provide learning opportunities, they provide protection, they provide stability and routine for children and normality. So without that, we have a large impact on children's mental health and their well-being. So children have been affected by their learning, but also, you know, protection in terms of families are not able to protect their children. You're looking at images there where children are desperately trying to find shelter, and there is nowhere safe, of course, for children in Gaza. So the impact is on their brain, but also on their body. It's desperate for them.
Rachel, talks on a ceasefire and hostage deal are continuing. They appear to be getting closer, although there are some key sticking points that remain. But a deal could mean that more aid is able to get through to where it's needed. What hope do you have of a deal being reached soon?
working in Gaza and working with our team who are extraordinary, and the commitment that we have for people to serve children and communities here is extraordinary. And we have to have hope. We have to keep hope alive for a ceasefire, to be able to expand our services and to be able to move around freely with unfettered access to populations. But, as this war goes on, and the grinding realities of living through this crisis for children and their families, it's exhausting. People are exhausted, but somehow there is hope that remains for a ceasefire here.